About 1.3 million Americans are diagnosed with skin cancer each year. In this video, you'll learn about the different kinds of skin cancer, the causes, and how it can be treated and prevented. Although anyone can get skin cancer, the risk increases based on lifetime exposure to ultraviolet light. Those who are most at risk are individuals over 50 years of age, people with fair skin, those who work outdoors or spend a lot of their leisure time in the sun, people who live close to the equator, or people who have already had skin cancer. Skin cancer is a disease that occurs when skin cells lose the ability to divide and grow normally. As these abnormal cells grow out of control, they form a mass called a tumor. There are three main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma, each named for the type of skin cell from which it is formed. If the tumor is limited to a few cell layers and does not invade surrounding tissues or organs, it is considered benign. But if the tumor spreads to surrounding tissues, it is considered malignant or cancerous. Basal cell carcinoma is the most common kind of skin cancer, as well as the least serious. More than 90% of all skin cancers in the United States are basal cell carcinomas. This type of skin cancer is most commonly caused by repeated exposure to the sun. It grows slowly and rarely spreads. Most often, it appears on areas of the body that have been exposed to the sun, such as face, neck, and hands.
Basal cell tends to be what we call friable. It's sort of delicate. It's that thing that you scrub your face with the towel when you get out of the shower, and that one area on the nose keeps bleeding.
Squamous cell carcinoma is more serious because it spreads to vital organs inside the body through the lymphatic system, but at a relatively slow rate. Squamous cell carcinoma can be removed before it spreads to vital organs. It commonly occurs on areas of the skin that have been in the sun, such as the nose, ears, forehead, lower lip, and hands. People most at risk are people who work outdoors, smokers and tailors, or construction workers who hold needles or nails between their lips.
Squamous cell carcinoma can look like a wart. It can look sort of scaly and rough, almost like a little patch of dermatitis or eczema in the skin, but very small. It can also be very large, but it does have that scaly red characteristic that you sometimes see in eczema.
Malignant melanoma is the most serious kind of skin cancer because it may spread quickly from the skin through the lymph nodes or blood to internal organs.
Some melanomas are pink and red. They can look almost pimple-like and be a sore that doesn't heal. That can also be melanoma, called amelanotic melanoma. And that can be pretty difficult and tricky to identify and diagnose.
The most common cause of skin cancer is prolonged exposure to the sun. Some kinds of skin cancer, however, may be hereditary. In those cases, skin cancer is caused by abnormal genes that children inherit from their parents. The most important lesson about skin cancer is that it can be prevented largely by staying out of the sun or avoiding direct sunlight. Reflected light from water, sand, or snow can be equally as damaging to the skin. If you need to be outdoors, cover as much of your skin as possible by wearing tightly knit fabrics and long sleeves, a broad-brimmed hat, and use a sunscreen. The best sunscreen is one that provides protection against both UVA and UVB rays. Be sure to protect children with a proper sunscreen as well. Children's skin is more sensitive than adults, so shielding them from the sun is important. The rules of prevention are best served by learning your ABCs. A stands for away, which means avoiding sun during the middle of the day when the sun's rays are the harshest. B stands for block, which means applying a sunscreen with an SPF of 15 or higher. C stands for cover up, which means covering the skin with clothing, hats, and sunglasses. And S, which stands for speaking out and teaching others how to protect themselves against sun damage. Knowing the early signs of skin cancer can help prevent the disease from becoming fatal. Use the American Cancer Society's ABCDE rule to evaluate skin changes. The most important warning sign for melanoma is any change in size, shape, or color of a mole or other skin growth, such as a birthmark. Watch for changes that occur over a period of weeks to a month and call your health professional if you have any of the following changes. One half of the mole or skin growth doesn't match the other half. The edges are ragged, notched, or blurred. The pigmentation is not uniform, or there are changes in color distribution, especially the spread of color from the edge of a mole into the surrounding skin.
Any combination of colors, when you have 2 or 3 or more colors, that can be a worrisome sign.
The mole or skin growth is larger than 6 millimeters.
6 millimeters is sort of a cutoff point, and anything larger than 6 millimeters, that's the size of an eraser on a pencil, can be of concern.
A mole or new area of skin is evolving or changing.
And that change can be bleeding, growing, becoming very pruritic or itching. Those types of changes also catch our attention.
If changes occur, contact a dermatologist right away to have the growth biopsied. Treatment for skin cancer is done in one of 3 ways based on the type of cancer, the location, and the stage the cancer is at, and the age and health of the patient. Surgery for the removal of tissue in the affected area, chemotherapy, which uses anti-cancer drugs applied topically, and radiation of the affected area to destroy cancerous cells beneath the skin or in areas of the body that are hard to reach by surgery. Early diagnosis and treatment offer the best chance for a cure. Be sure to do regular skin self-exams and ask your doctor to do a full body skin exam annually. For more information about skin cancer, log on to these informative websites.